Good afternoon. This is Nanette Leonardo. I'm a DNP candidate. This assignment is in compliance with the DNP 706 class under Dr. Webb. So, just a briefer, you are here in my classroom right now, my office, by the way, here at Charles R. Drew University, where I'm full-time faculty. I'm the assistant program director for the entry-level master's program. I teach both the entry-level master's and our nurse practitioner track here at Charles R. Drew. I also do bedside nursing. I'm a labor and delivery charge nurse at East LA Doctors Hospital. Likewise, I also do my practice during the weekends and some weekdays. I'm an OB nurse practitioner since 2013. So, my project actually has to do with postpartum depression. And as I go through this discussion, I might be glancing through my paperwork here, so I hope that's okay with you. So, a brief description of the stakeholders that I have identified actually five stakeholders for this project on postpartum depression. My scholarly project is on non-pharmacologic management of postpartum depression, particularly utilization of yoga and exercises to treat the signs and symptoms of postpartum depression among the population I work with, which are Latina women around East LA, Los Angeles. So, the number one stakeholders that I have identified, of course, will be the postpartum women. This will be the Latina women who are into their postpartum period up to 3 months post delivery, who will be exhibiting signs and symptoms of postpartum depressions. Among this would be anxiety, insomnia, eating disturbances, failure to concentrate, or subtle symptoms like they don't want to see visitors, or they feel depressed, or that they don't want to take care of the baby, or they're overwhelmed as well as emotional lability. So once I have identified this red flags, I will have to ask them to fill up the evaluation scale, which is the Edinburgh Post Depression Scale. And then once identified that they truly are exhibiting signs and symptoms of postpartum depression, I will get them into the program. I only plan to implement the initial phase of this program for at least 25 Latina women, irregardless of age and irregardless of parity, as long as they're exhibiting signs and symptoms. The second stakeholder will be the health providers, which is me, the other PAs in the clinic that I work for, the other nurse practitioners and physician's assistant, as well as the doctors that I work with in this OB clinic that I go to, which is Santa Maria, both in Echo Park. There are two branches in Echo Park and in Huntington Park. So I will have to educate them in order to identify the different signs and symptoms of postpartum depression. So they have to be made aware that this is a serious problem, and the earlier we identify these women and the earlier we get them into treatment, the better for the prognosis for these women. Another stakeholders that I have identified are the clinic administrators. Okay, these two clinics are being run by managers, and I have to get them to onboarded so that they could see the urgency and importance of how we could deliver service for these women exhibiting postpartum depression. Most of them are non-medical people, so they might not be as sensitive or unaware of how this issue could actually plague a lot of women nowadays, and it could actually bring discordance not only to the patient themselves but to their families and to their communities as well. So the next stakeholder I have identified are the project implementers. This will be the yoga teachers and the exercise instructors that I will be contacting, and I have actually contacted some of them to tell them that they will be giving instructions to a special group of women who are exhibiting signs and symptoms of postpartum depression. And I'm pretty sure some of them are not familiar with how the psyche of these women is and how sensitive they could be. So this will be a good introduction to them to be able to get familiar with the postpartum depression. Lastly, I have identified nurse educators also to be part of my program. nurse educators and nursing students, some of which volunteers or goes to the clinic where I work with. I want them onboarded also in order for them to know and to discuss further the importance of postpartum depression. We have to do this shift in mentality, that this is not just something that could be like shrugged off for women. A lot of them, especially in the Latina population, this is a serious condition that if left untreated could be detrimental for their families. The theoretical foundations, conceptual framework I will try to align my project with will be Beck's postpartum depression. This is a middle range grand theory proposed by Dr. Beck. And in this concept, she actually has said the mentality and the psyche of these women, okay, has to be viewed in a full context, not only through the environment, through the society, but also in the relationships that they have, not only with their family, with their loved ones, but also with other women and also with other family members. So Beck's adaptation middle range theory on postpartum depression is actually will be the framework of my study. With regards to the conceptual framework, I will be using the social and biomedical conceptual framework, okay, wherein I will be looking into the psychological context, milieu of the postpartum depression, as well as the social implications that it will have to the family, to the community, and to the environment, but also on the biological changes that has been identified as a possible causation factor for postpartum depression. Hormonal changes, depletion of certain hormones, particularly progesterone and estrogen, could be accountable for this. Oxytocin signaling systems, all of this actually builds up on what the causative things that actually would be the etiology of postpartum depression. Okay, so with regards to the plan for delivering my intervention, I have divided it into 3 phases: the pre-implementation, the implementation, and the post-implementation phase. The pre-implementation phase, which I'm going through right now, is soliciting all the resources and scouting for people who would be working with me, like instructors, yoga instructors, exercise instructors, the venues that I would need for these women. I'm also soliciting help from my advisor, Dr. Lucky from Brandman University, so that I could actually explain and get her feedback on how to conduct this project. From the very first classes that we have had in the first semester during the fall, and up to now, I have been collating all this data, and hopefully it will all come into place before the implementation phase, which should be sometime during the summer or late summer. During the implementation phase, I would have identified the 25 women exhibiting signs and symptoms of postpartum depression, divide them into 2 groups, and each of this group will undergo a 15-session bi-weekly yoga and exercise classes. At the end of each 15 weeks, they will have to switch groups, and then the other group will be going through either the yoga and the exercise things, okay? So prior to them starting these exercises, I will give them evaluation using the Edinburgh postpartum scale, and then compare it after the sessions, okay? Have them take another test after all the sessions were done, and see to it and evaluate how the exercise, the intervention, the non-pharmacologic interventions that I have mentioned a while ago has changed their symptoms, have changed their outlook with regards to the illness that they have had. In the post-implementation phase, I'm planning to evaluate the results that I have collated, and actually tally all of them and see and validate and actually submit a recommendation or submit my findings for my final presentation. But more importantly, get back on these patients and the co-workers I work with, the providers that I work with, in order to show them this evidence that there is truly help for these women, pharmacologic, truly safe. It actually goes both ways. They get a good sense of well-being after undergoing exercises and yoga without the side effect of the drugs. Nowadays, the management of postpartum depression is basically with antidepressant drugs, which we all know have a lot of side effects, and also with cognitive behavioral therapy, which is, in the first place, is expensive. And most of the time, people, especially among the Latina culture, it's not as acceptable as something as enlightening and lively where they could participate as this treatment that I'm proposing. So hopefully this will make a difference in the management of postpartum depression in the particular group that I have identified or that I will identify, and I will forward to you my results later on. And the corresponding attachment will show you my references, a couple of them that I have used in this presentation. So I will keep you updated. Happy viewing. Thank you.